Hello, my name is Monica Dillon, and I'm just giving you a lit skippet of the Patient Protection and Affordable Care Act. It was established in 2010 but didn't have full implementation until 2014. The act was established to help the consumers with access and coverage. With the Affordable Care Act, it was done in order to help the consumers get access that they needed. However, with the implementations that they put into this actual act and some of the laws that they added in with it, it still didn't allow every American to have the coverage that was needed or is needed. This act made employers also have employer-sponsored health benefit plans, but because of this, it was a lot of the employers changed from just a standard PPO to maybe a high deductible PPO, and that caused many of the employees to actually not be able to afford the coverage because of the deductible being so high and having to pay a $50 to $70 copay as well. With the ACA mandating that employers provide coverage, the employers made the insurance affordable to the employees. However, it was not still within their means of being able to have insurance coverage. Medicare and Medicaid has also made some provisions to their benefits and the way that you can become eligible for their benefits, but still is based off of income and it is still mandated by the government. And because of the different laws and the different things that come with these different health insurance plans, you have to make sure that you're getting a health insurance plan that your healthcare provider will take, because of the different contracts that the healthcare providers have with these different insurance companies. There still is some of the insurances that they're not accepting, so they don't actually tell you that until after they run everything and see that you're not within their network, or maybe you're not one of the insurances that they cover. And because of that, many consumers are being left with medical bills even though they have insurance coverage. When you're getting these insurance coverages, you have to make sure that you are getting coverage, that you're going to have coverage for things like specialty doctors, maybe nursing home care, or things like that, because a lot of these insurances that may be within your means of affording don't have that extra boost that you need in case you might have to go to a specialty doctor or get an expensive medication. They're not always covering these things. So the ACA was overall supposed to be a good thing, but it's still a lot of Americans that does not have healthcare coverage. And that's going to be an ongoing issue. From here on out, we all know that healthcare has been one of the biggest topics in the world for years, and it's going to continue being, even though there are new implementations and provisions been made to different laws and acts. It still is not enough to get the American people what they need for their health care coverage. So, just with that being said, even though you have coverage, you have to it's still things that you have to make sure that you're able to afford with this coverage. And like I said, with the high deductible plans, the high deductible means that their deductible is so high that you have to actually meet that deductible before you can even get covered at 100%. And then even with that, the prescription coverage goes along with the medical. So before some of your medications is covered at 100%, you have to meet the deductible. So just make sure when you're getting healthcare coverage that you are reading through the fine print and understanding what type of coverage that you are getting, whether it's a PPO or HMO or whatever, but just make sure you're getting what you're needing to help benefit you with this health care. Thank you.